Welcome to the Provider Communication Form Introductory Training. The purpose of today's session is to introduce to you a Provider Communication Form. The Provider Communication Form has been created to allow providers to communicate changes in service, service delivery, missed and canceled visits, hospitalizations, and other types of service changes electronically and directly to care managers and waiver service coordinators. Through this simple electronic submission format, all providers will be able to communicate directly to waiver service coordinators and care managers. This will allow a single source of data entry for all waiver providers to access and save for their records. Presently, we have been utilizing a paper, fax, email system of communication. You will recognize this paper format in which you're presently submitting notifications of change in services to care managers and waiver service coordinators. These are manually completed and manually submitted. They include all the information related to the member, the care manager, the types of services, and the dates and times in changes of service. Through this new system, you'll be able to communicate directly with all of our programs, care managers, and waiver service coordinators through a centralized portal. That portal will house the Provider Communication Form. The portal will be located directly on our Area Agency on Aging website. And the entire waiver provider network will be able to access the form and submit those communications directly to the team members. We will be doing away with electronic and paper form submissions, and all of our providers, including home health, personal care service, homemaker, assisted living providers, transportation providers, home delivered meal providers, will all be able to access a direct communication form linked to our Area Agency on Aging website and communicate directly with the waiver service coordinators and care managers. The form, as mentioned, is housed on our Area Agency on Aging website. By clicking the link, you will access our website and follow through the Programs and Services tab. Once you click here, you'll see an alphabetical listing of all of our services. As you proceed down, you will find the Provider Communication Form. By clicking the Provider Communication Form link, you will access the form directly. Also housed within that are instructions that you can print and review and walk through the form independently. The Provider Communication Form instructions walk through step by step the completion of the form and also allow you to access the link directly. You can print and save these instructions and access them at any time. At this time, we'll walk through the form and follow the process for completion. We have now landed on the Western Reserve Area Agency on Aging website. To access the Provider Communication Form, you'll click the Program and Services tab. Scrolling downward until you see the Provider Communication Form, and click that link. This is the Provider Communication Form. You'll be starting at the top and work your way downwards. You'll note that any field with a red asterisk is a required field, and you'll be unable to complete the form and submit without information in that field. Field number 1 is the provider organization. That is the name of the agency that is submitting. Field number 2 is the contact name, the name of the person at the agency who is submitting the form. Field number 3 is the provider phone number. That'll be the phone number for your agency. The next 2 fields will be the legal last name and first name of the individual or member. Field number 6, you'll be entering or selecting the plan or program that the member is affiliated with or enrolled in. This will be the passport, assisted living waiver, Ohio home care waiver, or one of the 3 managed care programs associated with the MyCare Ohio program. If you're unsure which program or healthcare plan the individual is enrolled in, please select unknown. Field number 7 will be that care manager, case manager, or waiver service coordinator who is associated and assigned to the individual. If you do not know who is assigned, please enter unknown. Field number 8 will be the Medicaid number of that individual enrolled in the program. Field number 9 will be the type of service change that you're reporting. Is it associated with personal care, home delivered meals, homemaker, or another type of waiver service? By selecting that, it will indicate the type of service change that you are reporting. If it is another selection that isn't indicated, select the other tab. For the purpose of this example, we will select personal care. By selecting personal care, the fields change to comport with that type of service. At that point, you will be able to select the type of change or types of change in service that you are reporting, including aides calling off, consumers canceling, or a hospitalization, institutionalization, or other cause for missed services. Anything indicating other will allow you to enter information that may not be captured in one of the choices. Once you have indicated the change in service, you are then able to select the type of units that have changed. For personal care service and homemaker service, this is broken down into 15-minute increments. Assisted living is broken down into a per-day unit. Home delivered meals is per meal. And transportation is per trip. Once you have entered the type of units that have been changed, you can then enter the date and the corresponding number of units changed in that period of time. For example, if on June the 1st, 2022, someone missed 4 hours of home health care, you would indicate 16 units of change on June the 1st of 2022. To follow that example, if on June the 1st, 2022, someone missed 7 meals, you would also indicate -7. And that all ties into the type of units that you have selected above. When there is service missed, it's important to note if the backup plan for that individual was enacted. By selecting yes, you're able to provide additional details regarding that backup plan and that backup plan utilization during the time that services were not provided. If the change in service was resultant of a hospitalization or skilled nursing facility stay, you're able to select and indicate the date of admission to that hospital or skilled nursing facility. Likewise, if you're communicating a discharge from a hospital and a resumption of service, at number 16, you're also able to select the date of the discharge. When reporting discharge dates, you are also able to report to the care manager or waiver service coordinator the date or pending date that services authorized would resume. Field number 18 will be a free-form field for you to communicate any other additional information that you wish to communicate to the care manager or waiver service coordinator regarding this member or regarding this specific change in services. Once you've entered all information and are ready to submit your form, you will click Submit. If there are any questions that remain unanswered, the form will direct you back to complete that question before submission will be allowed. Once the form has been successfully submitted, you will be able to print a copy for your own records. Also at that time, you can click Submit Another Response and follow up with the completion of the form for additional members. It is important to note that when selecting the Assisted Living button, you'll be prompted for unique service changes specific to the assisted living facilities. You will be able to select multiple entries specific to that change in service. Also required will be the room number of that individual at the assisted living facility.